Item 25 is an ordinance.
Discussion? Favoring, opposed, item carries.
Item 27 is an ordinance.
Discussion?
Tag. Tag.
Tagged by Councilmembers Costello and Bradford. And, multiple tags, and I'll go around and take tags. Since it's items been tagged, I might ask council members to remove their tags for the purposes of council members who wish to ask questions.
Thank you.
If there are any questions, and I know that Councilmember Martin wants to make an announcement. So, Councilor Cohen, you have a question? If you'll hold your tags, not for discussion, but for questions.
Yes.
Councilor Cohen.
Thank you, Mayor. My question focuses on whether or not, in consideration of this issue, and I guess this would go to Mr. Feldman. In our discussion, is there an opportunity to have a one-year extension of this contract rather than a three-year extension of this contract?
Councilmember, this is not an extension of the contract. Under the administration's authority, we could have extended Cigna's contract for the 2 option year periods. Without coming to council, we chose to go out and test the market, which allowed this robust process that we have going on. So this is not a contract extension. This is a new contract.
Yeah, all right. Is there an opportunity for the contract to be, for the new contract to be for 1 year?
No, ma'am. Well, I guess technically it could be, but because of the impact on employees, if we make changes to our health benefits, we would have to renegotiate the contract as well. But, so, Mr. Feldman, if the contract were not accepted, we have an existing contract with Cigna that could be extended for 2 more years.
We have two one-year option periods that could be exercised.
Okay. Okay, I have 1 or 2 other questions, and I'm not sure to whom this the question goes, but the committee that decides how to, in general, but in this case specifically, to whom the contract should be awarded, as I understand it, there was no, I wasn't here when the original contract, so it was, that there is no council member on the committee that makes the award, and, or there may not be any client on the committee when the award is made.
Councilmember, there are never council members on any of our contract selection committees.
Is that by law? Ordinance?
The administrative authority of the city rests in this chair.
Okay.
But there are, actually all the members of the evaluation team, other than the outside consultant Siegel, are beneficiaries under the system.
I understand what you're saying. Okay, thank you.
There is as we send around to council, there is a separate health benefits advisory committee. Councilmember Christie is the current council representative on that committee, and that is made up of representatives of the retiree groups, the unions, and the major departments across the city, and they advise on the actual, not who has the business, but the structure of our benefits. How much you pay for a copay, how much you pay for emergency room visits, and so forth. So there's council representative there and employee representatives. Questions from Councilmember Lester?
Thank you, Mayor. A couple questions. Is it possible, I know we've been trying, all of us have been trying to get our hands around the outcome and the recommendations. As of last week, we could not have any conversations with other bidders and competitors, which I think is an appropriate approach as far as the blackout period. Is there any way that we can get, or that the administration will give to the council, a matrix of scores that were used by those who looked at these firms, the matrix being, as you know, a listing of all the firms and the items that they were judged on in the individual scores? Is that possible?
If that matrix exists, absolutely, just as we provided a matrix on another contract we have.
Well, thank you very much. The second part is, I know that there was a third-party Siegel report, and that third-party consultant, and I can't remember how much we paid those consultants. Do you remember off the top of your head? That obviously we paid them to do a service. A third-party Siegel report has been presented, and I know a number of council members have asked to look at that report. That report has, as I understand it, been placed on a very limited restricted review. I know we can see it, we have to go look at it. I understand there's some proprietary information that's supposedly contained in the report, which I find a little troubling that we would pay for a report that contains proprietary information that the public can't look at. But I would ask this question: is it possible for the Siegel report to be redacted with the proprietary information removed from it so that each council member can have it to study at their own leisure?
Councilmember, it's not proprietary information from Siegel, it is proprietary information from Cigna, Blue Cross, United Healthcare, and the others that they provided.
I understand.
And the answer is that trying to redact that information would make it meaningless. Because you need to know what the individual companies put in their bid, which is what's available to Siegel.
Well, then that sort of begs a whole series of other questions in my mind, Mayor. How can we have a third-party contractor recommend to us and then issue a report that can't be reviewed by the public? And why would we ever ask for a report that contains so much proprietary information that the public can't look at? So I'm just asking if there's any way that we might be able to redact that report.
This is not an uncommon process, and the standard protocol from the city for multiple years has been that we create a reading room and allow council members to come in. Mr. Feldman, do you have a broader answer?
We have an obligation under the Public Information Act to protect proprietary information. And if we were to release any information that was proprietary, we risk exposure ourselves for violation of the act. What we're talking about is proprietary financial information from individual vendors. It would not be, I would not want to take the risk of trying to redact it only to wind up providing information that would get me into a violation of the Public Information Act.
Councilmember Martin.
Thank you, Mayor. I've had the opportunity to talk a little bit to the administration about this, and I did go on Monday night to look at the report with Councilor Feldman. And the report is a very good report. It contains a lot of great and valuable information. I know that Siegel is going to be here Thursday and Friday. What I would like to do is, because we are required by the 72-hour notice in advance, I would like to have the opportunity to have, as chairman of the Health and Benefits Committee, to have a full Health and Benefits Committee hearing with Siegel present. In order to do that, to comply with the 72-hour rule, the earliest we can do that would be Monday, but as Monday's a holiday, the next earliest date would be Tuesday. The reason why I would like to do that is when I looked at the report, all of my eyes went towards the financial data because that's what I do for a living. There was a lot of legal things that I really don't have the answer for. So in that case, I would love to hear the perspective from the legal people we have on the board. Councilmember Green, Laster, Bradford, to hear the questions that they ask so that I can listen to the answer. I think that presents the most transparent opportunity we have with a $1.5 billion decision that we have to make, which is probably going to be one of the biggest that I'll ever have to make in my years on council. So with that, I would like to today send out a notice and ask for information as to availability of council members to do this full body meeting with Siegel present so that we can ask questions of them, and then we can hear the questions asked and we can listen to the responses and form our own opinion. After looking at the data the other night, it does contain proprietary financial information. But in my opinion, that was presented by Director Reed the other day. When I looked at the report, the most proprietary information I saw was the exact financial data that Director Reed presented to us in the confines of a BFA meeting. So it's hard to sit there to look at information and to Try not to, you write as many notes. I wrote about 10 pages of notes. I would love a highlighter to get there and start highlighting them so I can refer back to it, but we can't do that, which makes this process a little bit cumbersome. But I would, once again, I would reiterate and ask again, Councilmember Laster's question, can we have a redacted report that does get rid of the proprietary financial data? And then I guarantee you, when I look at the proprietary financial data, it's going to match the same stuff that Director Reed gave us the other day. So with that, I will send out an email with the administration's permission to do that, to call for a subcommittee meeting of health and benefits where we have a full body and we have the ability to listen and learn and to ask transparent questions. So thank you to the administration for that.
Yes, Councilmember, and thank you for your willingness to chair the Benefits Subcommittee of Fiscal Affairs. It will be, we are not going to attempt to redact the Siegel report. If Siegel can provide a redacted version, I'll leave it up to them, but we will continue with the process of council members who wish to read the entire report. The reading room is available in the legal department, and looking to see if there's anyone who can tell me whether, I don't know, Councilmember, have you confirmed that Siegel will be able, that a Siegel representative will be able to be here on Tuesday?
No, ma'am, I have not, but in talking with William Paul, I think that they would probably make every attempt to be available, hopefully.
They will certainly make every attempt. We will.
Right. I'd love to have this Thursday or Friday, but the 72-hour precludes us from doing that.
Councilmember Pratt.
Thank you, Mayor. My two questions are literally on the floor already. One, can we make a request of Siegel that they provide some form of a public document that we can talk about in a public session? I think I do consulting work too and deal with proprietary information, and generally the protocol is if you are hired by a public entity, there may be a report that you do that has proprietary data in it, which is a sterile report, but you have almost a professional obligation to produce some document that the public can have access to. So that's my first question. Can we request Siegel to produce a public document since they were hired on a contract as a third-party evaluator? And two, the request that Councilman Martin has on the table, along with Councilman Laster, that the quiet period, the no contact period ended last Friday PM. So we really only had Monday, Tuesday of this week to try to get information and talk to the other vendor about this issue. So we haven't had a public opportunity to discuss this broad issue. The question was, can we have some type of committee, a subcommittee meeting where openness and transparency can be had? I think that's what's on the table now. Those are my two questions. Thank you.
And the only thing I will caution council members is that we're a very rare public body in that we have no executive session. And we'll make every effort to have Siegel available and get the redacted version of the report. But there may be, because we cannot have an executive session, there may be things that can't be discussed. Councilmember Costello.
Thank you, Mayor, and I fully support what my colleagues would like to do as far as chairing the subcommittee. But I do want to remind my colleagues that the presentation that we had last Tuesday, a week ago yesterday, was really the fact that we had a well-experienced group of people that vetted the proposals and made the selection. Siegel was just used as a third party. They didn't swing the decision, they confirmed the decision made by the selection committee. So I just want to remind my colleagues of that. And please go back to the presentation that was made by Director Reed at my committee meeting, you'll see that. So I'm all in favor of having a consultant come here, but I'm still relying on the well-qualified staff and people that actually vetted through the process in great detail. Thank you.
Councilmember Martin.
Yes, it's my opinion that Siegel did make a recommendation because it was in the report. They recommended Cigna. Their number 2 choice was United Healthcare, while the committee's number 2 choice was Blue Cross Blue Shield. So they did make a recommendation. They did take a path that was independent of the city. You had two silos working at the same time with the Chinese wall between them, working independently of each other to come up with a conclusion. And Siegel's conclusion was, number one, Cigna, based on their facts, information, data, analysis. Number two, United Healthcare, and number three, Blue Cross Blue Shield. The consistency was both independent parties recommended Cigna as a choice for the city, unless I'm wrong.
Council members, we asked the tax to be released for questions and not necessarily debate, so. Mayor Pro Tem Gonzalez.
I just want to thank Councilmember Martin for making a suggestion and for willing to hold a meeting, and just to put it in context going forward, that this is just the selection process for the third-party administrator, not really a discussion on the financials of the benefit design plan itself, which is something in the hands of the administration and the city. You know, it's a separate conversation, and we designed the plan, and we also made a policy decision last time to go to self-insured plan. So that needs to be considered as we go forward, that this should be a discussion about the selection of the third-party administrator. And in this case, a recommendation was done for Cigna, but we should limit discussion to that.
Agreed, and thank you, Councilmember. And there is a Health Benefits Advisory Committee that weighs in on what the structure of benefits within the plan are. Item is intact. Councilmember Bradford.
Thank you, Mayor. I have one final question. The item in chief, it is a 3-year contract with 2 1-year optional renewals.
Correct.
So there could be a 1-year renewal of the 2-year option.
We're in the 3rd year of an existing contract that had 2 1-year options. So Siegel could have, without coming to council, we could have just extended. We chose to test the marketplace to see, because it's a very fluid situation out there in healthcare, whether we can do better. But I thought Councilmember Cohen's question was, could we just do a 1-year contract with this new contract? And our belief is that no, it was not bid as a 1-year contract, it was bid as a 3-year contract.
Let me re-urge my question, because I wasn't sure what Councilman Cole's question was. There is an option before the body today to extend for 1 year the current contract.
No,
I thought we were under a 3-year with 2 1-year options.
no, this is a new contract.
No. I'm not talking about the contract that's on the table
Oh,
today.
there is it is not before us.
Yes.
It is the administration's prerogative to extend with Siegel for another year.
You could exercise the option.
Cigna.
You could exercise the option to
Yes.
extend with Cigna 1 additional year.
Correct.
Thank you.
The item has been tacked.